Good afternoon. I'm Lee Harris, the Mayor of Shelby County. I am pleased to be here on behalf of the Joint Task Force coordinating our response to the COVID pandemic. A few announcements. This week, we will be in front of the County Commission supporting a proposal to allocate about $2 million in funding for COVID relief. That funding will go towards several items. We will be spending the money on masks and goggles and thermometers and gloves and hand sanitizer. In addition to that, we need to beef up our staffing in the health department, which has been working long hours to conduct investigations and contact tracing. And we need to make sure that our staffing is at adequate levels in our emergency preparedness office. Finally, that funding will go to seed a very special COVID assistance fund that our Division of Community Services can use to make sure that we have a sufficient social safety net in place. The total proposal for the assistance fund is about $500,000. Let me say that we're thankful to Commissioners Sawyer and Commissioner Jones for their leadership in bringing this special proposal to set aside $2 million for COVID relief. We previously talked about this in the last commission meeting and we got a little bit stuck, but Commissioner Jones and Commissioner Sawyer have stuck with it, and we believe that we will succeed on Wednesday in setting aside COVID relief funding. Additionally, we know that juggling work and family life can be very challenging, particularly for the essential workers that still have to report to work every single day. That's why we have been working with the YMCA to provide daycare or childcare for our essential workers. For background, this work began about a month ago when the governor passed or approved Executive Order number 14. That order made it easier for daycares to operate and serve essential workers. We expect this child care option to be available to essential workers this week and to be available at 5 YMCA locations. So thanks to the YMCA for their partnership, the City of Memphis, and all the folks on the Joint Task Force that have worked on this effort. In addition, we have been developing important guidelines for operating daycares and child care centers. The guidance will be available on the Shelby County Health Department website. As you know, our coordinated response to COVID involves many, many agencies. And so today we want to invite one of the agencies that has been working on our social safety net and making sure that we catch and help those that are in need. I'm referring, of course, to our Division of Community Services, which is ably led by our director, Dorcas Young Griffin. This agency is responsible for various programs, rent assistance, utility assistance, and so forth. We must remember that this is not a time when we're just missing our favorite meals at our favorite restaurants. This is a time when livelihoods have been sacrificed. This is the time when tuition and mortgage payments have been missed. This is a time when thousands more are in poverty and when food insecurity has grown. And so the work of the Division of Community Services, CSA, and so many others is really critical at this time. And so with that, I'd invite to the podium Director Young Griffin to give a brief report on her organization. Thank you.
Good afternoon. Thank you to Mayor Harris for that introduction. Again, my name is Dorcas Young Griffin, and I'm the Director for the Division of Community Services for Shelby County Government. All services that we offer through the Division of Community Services continue to be available, including our emergency assistance, our housing, our rent and mortgage assistance, services to victims of crime, services to seniors, and services to those who are justice involved. In line with the CDC and local guidelines and our commitment to do everything possible to be safe and accessible, we have limited face-to-face contact for many of our services, but we continue to be available by phone, by email, by video conferencing, and other means to make sure that our neighbors are served each and every day. Phone numbers and detailed information about the services that we offer through the Division of Community Services are located on our website at shelbycountytn.gov under the Division of Community Services. I would like to impress upon folks during this time, many people are facing a situation that they have never faced before. They have never been without food, have not been without the ability to pay their regular bills. I want to encourage each and every person who is struggling right now to ensure that they check out our website, check out our phone numbers, and give us a call. You may qualify for services that we have. It does not interrupt any other benefits that you might receive. Two particular things that I want to mention that are available to people are the TANF Emergency Assistance Dollars through the state of Tennessee. Beginning March 26th, families could begin to apply online for up to 2 months of emergency cash assistance if they were employed as of March 11th and they've lost employment or they've lost at least 50% of their earned income as a result of the pandemic. It is a completely online process, but you can access all information on the State of Tennessee's Department of Human Services website. Again, accessing these funds does not impact any other assistance that a person may apply and qualify for, such as unemployment benefits. I also would like to mention the great, incredible lift that the Mid-South Food Bank is undertaking at this time. There are countless numbers of our neighbors who continue to need access to food each and every day. Mobile pantries are scheduled several times every day throughout the week. I encourage you to check out the website at www.midsouthfoodbank.org and find out where these mobile pantries may be located near you. The final thing that I want to mention today, in government, we are doing all we can to ensure that we can respond to the needs of our neighbors. But we also understand that we need help from the private community, from donors, from other folks. And so there has been a regional response fund that has been set up through the Community Foundation, and they are able to actually help provide direct assistance to some of our local nonprofits and to some of our citizens here in this region. As of April 9th, a little over $1.6 million has been raised by the fund. Based on models from other cities, 60% of the money that has been raised will be used for this first phase, rapid response grants to meet immediate needs that have arisen from the crisis. The remaining 40% will be set aside so that we can work on recovery, especially for nonprofits who have lost significant earned income during these times. To date, over 30 organizations have been funded to provide services like food, emergency shelter, and housing, and direct assistance for laid-off workers in the hospitality and restaurant industries, some of the hardest hit during this crisis. I encourage you, as you look for ways to give and support the efforts happening in this community, to go to the Community Foundation's website at cfgm.org, where you can find out more about the Regional Response Fund. With that, thank you. I would like to now introduce our Health Officer, Dr. Bruce Randolph.
Good afternoon. I'd like to just give the daily update as of April 14th, 2020. The number of cases in Shelby County is 1,351. This actually represents 24% of the state cases, total cases in the state of Tennessee as of 4/13/2020, with 5,610. In Shelby County, we have 30 deaths. To date, we have tested 14,429 people. We have a positivity rate of 9.4%. In surrounding areas or jurisdictions, Tipton County, Tennessee has 50 cases, DeSoto County, Mississippi, 178 cases, and Credon County, Arkansas has 115 cases. When we do further analysis of the Shelby County cases, we find that 82.9% of the cases fall in the age ranges of 21 to 70. And when we look at those cases by race, we find that 71% of the 761 cases that we have been able to analyze, 71% of those are black, 23.5% are white, and roughly 4.69% are Hispanic. We want to emphasize the fact that we have partnered with other community partners to enhance our testing. And if we could list the various sites that we've been able to assist in standing up, and you can see them displayed there where you can go get your COVID-19 testing performed. You do not have to worry about not having insurance. You can have your tests there whether you have insurance or not. And we want to thank our partners for being able to put together these various sites so that we can increase the number of testing that we do, because it is very crucial in our attempts to still control the spread of this virus. And with that, I just want to just take this opportunity to just thank the citizens of Shelby County and to encourage you to continue to stay home and be safe, continue to adhere to the safe separation, social distancing. If you leave your home, continue to wear your mask, continue to wash your hands, and let's continue our effort to control this spread. Let's not give up now. We're too close to the finish line to turn back now. So I just urge you to continue to work with us so that we can limit the deaths and the hardship that this virus is causing. With that, I will stop here and entertain any questions that you may have.
Jessica Gertler with WREG.
Hey everyone, the state health department has
Jessica
told me
Gertler.
it's not recommending
WREG.
serology testing at this time. So why do you think that is, and do you agree with that? And then also for enhancing testing, it seems like it's taken a while to get these additional sites up and running. So why do you think that is, and do you agree with that? What's the biggest hurdle you're facing when it comes to getting more testing in more areas?
The two main hurdles, personnel and supplies, the testing materials. But we have managed to identify personnel within the Shelby County Health Department that we will assign to helping these community partners so we can actually do the specimen collection. Along with that, in order to do the specimen collection, you have to have the swabs and the other equipment, the other supplies. And so those are the two challenges that we're confronted with, but we are addressing them, and we're confident that we will be able to expand the number of testing that we're doing. As it relates to the serology question, I think that that is to still be determined and developed.
Bradley Broders with Local Memphis 24.
Hi, good afternoon, everyone. I have two questions. My first question is about, I know yesterday Mayor Strickland announced the primary hospital being at the former commercial appeal building. If someone can maybe speak on, is the plans to have everything in their beds ready to go? If someone could talk about kind of the process of getting that ready. And has there been any decision since last week when there was more uncertainty about would minor symptoms patients go there if necessary? And my second question, Mayor Harris might be able to help me out with this. Two PATA employees have now tested positive. If there's any update on how certain agencies like those are being tested with temperatures or other things like that on the job. Thank you all.
I didn't hear the first part of that. Did anybody hear the first part of that? You sure about the testing, but what did he say about, I didn't hear the part.
Well, good afternoon, everybody. Doug McGowan, representing the Joint Task Force. On the first question, Brad, yes, it was announced yesterday that the commercial appeal will be the primary alternate care facility is what we're calling that. As you know, we also secured a Gateway Shopping Center, which would be a secondary site. The build-out will commence on that commercial appeal building as soon as the lease is signed, and we expect that to happen sometime this week. That building will be used to house low acuity COVID-19 positive patients. They would get there by first being screened in an emergency department, and then they would be placed in that low acuity setting based on their needs. Typically, they're going to need oxygen and maybe some other low acuity care. It will be outfitted with beds, the appropriate oxygen. It will have some step up ability should somebody get more critical and need transported, but that will become the primary facility. Anticipate that coming online within the next 30 days. Staffing will be the next challenge, and we're actively recruiting staff to man that up. We do have the top 3 officials who will be running that facility for us, and now we're working on the staffing plan.
And I'm sorry, Brad, I did not hear all of your question, so I don't know if we can go back to you or not, but what I will say is there's no doubt about it, because I heard part of it, there's no doubt about it that we are focusing aggressively to protect those members of vulnerable populations. The populations that come to mind are those with serious underlying medical conditions, our residents of nursing homes, and our prison population and the detainee population. So with respect to the prison and the detainee population, the sheriff has done a really great job working with a lot of stakeholders to make sure that the detainees at 201 Poplar are as safe as possible. So everyone that goes into 201 Poplar, there's a temperature check. He has eliminated in-person visitation at this point, and out of an abundance of caution, he's worked with the health department and many others to mandate testing for those who need it. And so the best example of that, of course, is the testing that they called for some of our juvenile detainees, and they've just about completed all that testing. With respect to the nursing homes, which is another really, really vulnerable population where we're trying to be really, really aggressive to create extra protections, all the employees there will be required to have a temperature check before they go in. Any employee that shows a fever will be sent home, and we're going to continue to strengthen those protocols. And so you'll see more of that on Friday when I renew my executive order, again, along those same lines of making sure that we require temperature checks at nursing homes and other places where there are vulnerable populations. Thanks.
Laura Testino with Commercial Appeal.
Hey, I have 2 questions. The first is this, that there are 63 cases for ages 0 to 20 years old, with 7 of those for children 0 to 10. How many of these children have needed to be hospitalized, and what else does the health department know about the demographics and symptoms of cases for these ages? Question has to do with daycares. I can ask it now or come back.
We'll do a follow-up.
You can go ahead and ask it now.
Okay. With the daycares, the need, can you discuss the cost associated with the YMCA and how many spaces will be available at that center and how that matches to any need you've heard from operators in Shelby County?
As it relates to the cost, I will have the mayor see if he can address that aspect of the cost of the daycare there at the YMCA. In terms of your first question about those number of cases that we have with ages, you said 0 to 10? Is that your question?
Yes, 0 to 10, and then, any children in that 0 or 11 to 20 age range as well.
And your specific question was, can you repeat that again?
Sure. Those two age groups comprise 63 cases. And how many of these children have needed to be hospitalized, and or what else does the health department know about the demographics and symptoms for cases in this age range?
The number of the kids that need to be hospitalized, I do not have that data before me. Nor can I give you really the demographics on those cases as well. We could provide that information later as we do further analysis. But sometimes when we only have just a few numbers, we just kind of cluster those together to protect the privacy of the individuals.
Jackie Massey with Fox 13 Memphis. Oh, I'm sorry. Did you?
Hi, how are you doing?
Jackie,
I have a question. Hello, can you hear me?
Yes. Can you hold just a moment? We've got another answer.
Thanks a lot for the question. On the children that have been hospitalized, we'll take a look to see whether or not any under 18-year-olds have been hospitalized and try to get that information to you. We don't have it currently, at least as far as I know, and so I will try to make sure we get you that information about under 18-year-olds that have been hospitalized. The demographic information, we put out a lot of demographic information. As you can tell from the information we put out, the minority communities seem to be heavily impacted by the spread of COVID-19. If we find any information to suggest that children are a different demographically speaking, then we will also put that information out. I think the other question was childcare. With respect to childcare, we have worked out a partnership with the YMCA that so far there won't be any cost to Shelby County employees for child care. So essential workers and so forth, to the extent we use up that capacity, that may be another question, but at least in this first phase, there will not be any charge for the child care. Again, there are lots of precautions that are taken at these child care facilities for essential workers. Among them, the kids, the temperature for the kids is going to be taken twice a day. There are a couple of documents that substantiate some of the protocols. One is a frequently asked question document, which we're going to post on the Shelby County Health Department website. And another one is a guideline for daycares who want to open up for essential workers. And we're also going to make sure that that's posted on the Health Department website and also made widely available. Thanks.
Jackie Massey, Fox 13.
All right, round two. Okay, so I had a quick question about the Gateway Shopping Center. I've been hearing from sources that that's not necessarily going to be a temporary overflow hospital anymore. Can you talk a little bit about that and why there's some sort of confusion about if that's going to be an overflow hospital or not? And if it still will be, when is it going to start? Like, when are they going to start taking patients, and when is the building going to happen? And my other question about the CDC latest findings, talking about how you can get the coronavirus like 13 feet away now. You don't have to be 6 feet; it's 13 feet away. And about how you can get it, like the coronavirus can like live on shoes and stuff, like of hospital workers. Like, how are you preparing for that? Like, will that impact any of these social distancing guidelines over here in Shelby County?
Start with question one about the Gateway Shopping Center. That building has been secured. There is a lease signed on that, and there is a contract should we need that to be built out. But when we secured the commercial appeal building, that became the primary site that will be built out. There will be no construction started on the Gateway Center until the commercial appeal building is completely built out, with approximately 400 beds in that facility. There have been some changes across the state. Originally, there was the thought that they would be building about 4,000 additional hospital beds. That has been scaled back based on some of the flattening of the curve and some of those projections that are showing we may not need as much for the surge. And so here in Memphis, we couldn't put 1,000 beds in any one facility. The commercial appeal is our primary site for a number of reasons: A, the size; B, the layout; and C, the proximity to high acuity care right down the street in the medical district. So that becomes the focus of main effort, is to build out the CA building. As that is built out, depending on the size of the curve and the ability for us to flatten that, the number of patients that we're actually seeing hospitalized will be the determinants on whether we build out the Gateway Shopping Center. So there is no active work happening on the Gateway at this point as of yesterday. All attention has been turned to the CA building, but we will still hold that in reserve. I'll defer to the doctor about the questions about the COVID and 13 feet versus 6 feet.
Yes, recently there has been some revelation that the virus seems to spread a little further than anticipated, and that there have been some studies that suggest that even it may be on the floors and on the shoes of healthcare providers. Currently, we're still holding to our recommendation of distance of 6 feet separation at least, and continuing to wear our masks and continue to wash our hands. And as we learn more about this revelation, we will adjust recommendations accordingly.
Kendall Downing, WMC TV.
Hey everyone, I just was wanting to see, were there any other nursing home cases at the health department or nursing home outbreaks that the health department could report today? Because we were getting some calls about some. And then Doug, this might talk a little bit about what you were speaking of. Is it possible that the CA building may not ever have a patient in that? Because I know that we're getting calls from folks at area hospitals since the patient count is down because of a lot of procedures are not being done. So could patients be housed all at hospitals and the CA building is being built out as a precautionary measure? Is that a possibility? And then a third question to just slip in on the end. People are asking us what reopening could look like and what that could look like for businesses. If someone could just talk briefly about that.
Thanks for that. I'll start with the second question and the third question because I can't remember the first. But for the second question, we said very early on that the best thing that could happen as we prepare for this is that we have to build a facility and that we never have to use it. Obviously, we want to be very strict with our use of the funds, and we want to make sure that we're not spending money unnecessarily at the state level, the federal level. So that is a possibility. Based on the forecast that we have today, we do believe that a surge is coming in late May or early June that would stretch the capacity of our existing hospitals. I do want to emphasize the fact that we have a medical response team here on the ground. It is made up of the 4 big hospital systems. They have all come together with under the leadership of the Shelby County Health Department, and they have put together what they believe to be their surge capacity. So there's the number of beds they have today in our region is about 2,700 beds. That's all inclusive. It's just shy of 4,000 when they get to their surge capacity. Now that means they need some additional equipment, some additional beds, and some additional staffing to get to that surge capacity. But what that means for us today is that we're only seeing about 50% of our surge capacity taken up with acute care beds, about 40% of our ICU beds are currently taken up, and about 30% of our ventilators. That means that we have room to absorb the surge. The question is just, do we have enough room for those low acuity patients? Will we ever reach maximum capacity at the hospitals? If we do, as the forecast says, we will come either very close to or we will trip and fall over into an excess capacity situation, then we need to have a place to put those low acuity patients. And that's why we're moving forward here in Memphis and in Nashville with building alternative care facilities. Now, what could reopening look like? There's been a lot of discussion about reopening, no less so here in Memphis and Shelby County and with our suburban mayors. So we will look to begin discussing that. We have already had some initial discussions, I know, internally with every different municipality and in the task force. So in the coming days, you'll see us come together as a team to start looking at what reopening might look like. Again, we are looking at the data. We are looking at what triggers would give us the ability to begin to reopen, but you can expect that just like you've seen in the national news, that will not be a light switch. It will be a progressive opening of critical functions, expanding more businesses into the essential category, and/or with some additional restrictions. So you should look for that coming out, but it won't be a light switch and everything just suddenly gets turned back on. Can you repeat the first question so I can route it to the appropriate party? Okay,
Hey
we'll
there.
move on.
I'm here.
Yes.
I'm here. Okay, it was just, have there been any other nursing home cases or outbreaks announced from the health department other than the ones that we were told about yesterday? Is there an update with that?
We'll give you a break this time. It's supposed to be a primary question and an alternate, but you had 3 today. So I'll turn it over to Dr. Randolph for the first question.
So in reference to the nursing homes, currently we're working with 3 senior care facilities. In terms of any new outbreaks, I'm not aware of at this moment. We have a team of investigators that are working with the senior care providers and facilities that we're investigating. And so if there are any new ones, certainly I would know before the end of the day, and we will be investigating those as well.
Final question for today's briefing. Bill Dries with the Daily Memphian.
Yes, Mayor Harris and Chief McGowan, the president has said that he has the power to restart the economy. Governor Lee has signed an order saying that this goes until the end of this month. Can the president or the governor counteract the states of emergency that have been set by local governments here, in your opinion?
So thanks a lot for that. I think that all of us want to be in close partnership with state and federal authorities. I think that whatever comes of the announcement that we've seen in recent days from those partners, they will receive feedback from Shelby County and Memphis. I think they're open to receiving that feedback and designing a particular approach that applies to the conditions here in Memphis and Shelby County. In fact, Mayor Strickland and I were on the phone today with the mayor of the Knox County and the mayor of Knoxville discussing that very thing with the governor. He expressed his desire to really be in harness with municipal leaders here in Shelby County. And so I do think that at some point we will talk seriously about what the next phase of this looks like, but I think it will be a particular approach that applies to Shelby County. So for example, I can think of in Shelby County, not to beat a dead horse, but I do think we have some particularly vulnerable populations. You've heard a lot about nursing homes, you've heard a lot about prisoners and detainees, and I think in Shelby County that we're going to continue to be aggressive for a good while yet to make sure that folks that are residents of nursing homes have adequate protections, to make sure that there is no outbreak or serious outbreak and severe treatment for those that are detained or in our prisons and other vulnerable groups. So I think that that approach will continue, and I think we'll continue to talk with the governor and federal authorities as needed. You want to about syncing up? All right. Before we close, I did want to send a shout out to the Shelby County Youth Council. The Shelby County Youth Council is a group of high schoolers selected through a competitive process and representing all the various communities in Shelby County. And they have been serving for, I think, about a year now. And of course, their service is a little bit different now that we are in this public health emergency. But nonetheless, the Shelby County Youth Council has really been aggressive in promoting a campaign around social distance to their contemporaries. So please check out the Shelby County Youth Council. They're also planning a virtual youth summit to give the youth perspective on the fight against COVID-19. And they're doing that in partnership with Bridges. So you can go to bridgesusa.org to find out more information, or you can follow the Shelby County Youth Council and see some of their promotional campaign around social distance on Twitter at SCYC901. The Shelby County Youth Council, I believe, has put it best when they have said that even though all of the kids are out of school, you can keep learning every day. Thank you.
Thank you. This concludes our briefing. Everyone, please stay healthy, and we will see you tomorrow.